For millions of Americans, one of the biggest hurdles to just getting basic medical care, it isn't about insurance. It's not about finding a doctor. It's something much more fundamental, a physical barrier that's, believe it or not, hiding in plain sight in clinics and hospitals everywhere. So today, we're going to break down what it is and what's finally being done about it.
All right, let's just dive right in with a question for you. Imagine this. You go for a checkup, but the exam table, it's way too high for you to get onto. Or maybe the doctor can't get an accurate weight because the scale just wasn't made for someone in a wheelchair. And look, this isn't some hypothetical scenario. For so many people, this is the daily reality. And it leads to some really serious stuff, like missed diagnoses and just plain unequal care. I mean, we all know that just getting to a doctor's appointment can be a huge hurdle, right? In fact, the data is pretty clear. People with functional limitations are 2.6 times more likely to delay care just because of transportation issues. So now imagine you finally overcome that hurdle, you get to the clinic, only to find out the equipment itself is the final wall you can't get past. The problem just gets bigger and bigger.
So, what is this hidden barrier? Well, it's the widespread lack of what's called accessible medical diagnostic equipment, or MDE for short. And really, this is just the basic stuff, the exam tables, the weight scales, the imaging machines, all the gear a doctor needs to actually do their job. And the consequences of this are, well, they're really serious. Studies have shown that when the equipment isn't accessible, patients often end up being examined while they're still in their wheelchairs, and that can hide a ton of medical problems. Or they're just asked to guess their weight, and we know that people are, well, not very good at that. This can lead to things like totally wrong medication doses and missed chances to track chronic conditions. It's really a fundamental breakdown in the quality of care.
You see, for the longest time, this was a problem people just knew about anecdotally, right? Through stories. But now, thanks to a huge study that looked at thousands of primary care practices in Los Angeles County, we can actually see the scale of this problem. So let's take a look.
Okay, so this map shows us something really fascinating about height-adjustable exam tables. The darker brown spots, those are the areas with the most residents who have mobility limitations. And the numbers you see in each zip code, that's the number of clinics that actually have an accessible table. And what you see is just a sea of zeros and ones, even in the areas that need them the absolute most. It's clear there's almost zero connection between where people need this equipment and where it's actually available. This chart here breaks it down even more clearly. Almost 38%, that's nearly 4 out of every 10 zip codes in the study, had zero primary care practices with even a single height-adjustable exam table. Zero. Another 28% had only one. So for patients living in those areas, getting a basic, thorough exam is really just a matter of pure luck. And if you think that's bad, well, when we look at accessible weight scales, the picture gets even worse. It's the same pattern all over again, just huge areas of the county, no matter how many people there need them, with no way to accurately weigh a patient who uses a wheelchair.
Yeah, just let that sink in for a second. Over 57%. That means in more than half of the communities they looked at, there wasn't a single primary care practice that could properly weigh a patient with mobility issues. This isn't just an inconvenience, folks. It's a massive barrier to getting safe and effective healthcare. But after decades of advocacy from the disability community, the story is finally starting to change. Federal agencies have now stepped in with new, really specific rules designed to close this accessibility gap once and for all. So this timeline kind of shows you how we got to this point. I mean, look, anti-discrimination laws like the Rehabilitation Act and the ADA, they've been on the books for over 50 years. But they were often, a bit vague. The real game changer came in 2024, when the Department of Justice and HHS put out these final rules that lay out specific technical standards for medical equipment. And, most importantly, they set a firm deadline for compliance, 2026.
Okay, so just so we're all on the same page, when we say medical diagnostic equipment, or MDE, what are we talking about? It's really the basic tools of the trade for any healthcare provider. Things like exam tables, scales, mammography machines, x-ray machines, the essential gear you need for any kind of diagnosis or preventative care. So what do these new rules actually require? Let's break down this 2026 mandate. All right, the really crucial shift here is from a pretty general concept to very concrete requirements. Before, providers just had to make sure their program as a whole was accessible. That was super vague, really hard to define, and even harder to enforce. But now, the new rules point to specific technical standards for the equipment and set crystal clear deadlines. All that ambiguity is finally gone. And here's the bottom line. the most important takeaway for the vast majority of healthcare providers, and that includes private urgent care centers that take Medicare or Medicaid, they must have at least one fully accessible exam table and one accessible weight scale by July 8th, 2026. This isn't a suggestion, it's a non-negotiable deadline. So, what exactly makes an exam table accessible under these new rules? Well, it's not just one thing, it's a few key features. First, it has to have an adjustable height that can get down to between 17 and 19 inches from the floor. That specific range is crucial because it lines up with the seat height of most wheelchairs. It also needs to have sturdy supports for transferring, like grab bars. And finally, there has to be clear space underneath so a portable patient lift can actually fit and do its job.
And get this, it's not just about the table itself. The rules also require clear floor space around it. Why? Because an accessible table in a tiny, cluttered room isn't actually accessible at all. An exam room needs enough space for a wheelchair to turn around and clear paths to get to the table. You can't just buy the right table, stick it in a cramped corner, and call it a day. That won't meet the new standard.
And it goes beyond just the hardware. The new rules also tackle a really critical human element. Staff now must be trained on how to actually use the new equipment and, just as importantly, how to safely help patients with transfers. And here's a huge one. Providers can no longer tell a patient they have to bring their own family member or an aide to help them get on the table. That responsibility now rests squarely with the provider. Okay, so we've got new equipment standards, we've got new training requirements. But what does all of this really mean for the patient? What's the impact on their experience and on health equity as a whole? This quote here from the U.S. Access Board, they're the ones who developed all these technical standards. It really gets right to the heart of the matter. This whole thing isn't just about checking a box for compliance or trying to avoid a lawsuit. It's about three simple but incredibly powerful ideas: dignity, safety, and equity in healthcare. And the impact of this is going to be profound. I mean, we're talking about safer transfers for both patients and the healthcare staff. It means doctors can finally do more thorough, accurate exams, which leads to better diagnoses. It means medications can be dosed correctly because they're based on an actual weight. And ultimately, all of this adds up to better preventative care and a real, tangible reduction in the health disparities that people with disabilities have been facing for way, way too long. Look, these new rules are a massive, monumental step forward in making healthcare physically accessible. There's no doubt about that. But the equipment, that's only part of the equation, right? The law now requires staff training, and that kind of pushes us toward the next frontier, making sure the culture of healthcare is just as accessible. So how do we make sure every single patient is treated with dignity, with understanding, and with respect? That's the big question we're left with now.